you're the mother. It's your job to feed your child. So it's sort of an innate need. You start out that way right from day one, right? So you think about it, and we were constantly evaluating whether it was something that was going to make our lives easier or Ben's life better. And both of those things were important, but we always were sort of putting them in perspective. And I think there were moments where we did question, would it make, as Stuart said, it better for Ben to get a better application of the medicine if he could get it internally. But I did have one experience where a different GI doctor, not Dr. Russell, actually said to me, I said, well, what happens when there's that moment where the feeding tube is just keeping Ben alive? And he said to me, well, you're going to just have to choose not to give him any formula because we don't take it out. And I said, so you're telling me my choice today is I can put a feeding tube in and feed my kid. I'm basically in control of when my child's going to starve to death, is basically what I felt like he was telling me at that moment. And Pat, actually, when we got involved with palliative care, and actually a new GI doctor, which was helpful, we got the freedom to think about it in all of those different levels. And she demystified the fact that, yes, we could take the feeding tube out, but also, yes, oftentimes the body just sort of lets you know the feeds get rejected, and Ben will tell you. So, but doctors don't go there. They go right from A to B, and they don't talk about what's in between. They don't talk about, that doctor didn't want to hear me ask that question. What, you're telling me that I basically have to pick when I'm going to starve my kid? That's what you're telling me. And he didn't want to hear that question. But Pat palliative care could hear through it and talk about it medically, talk about it emotionally, talk about the physical changes that Ben's body would go through. That's a lot to put together into one package. And it's so helpful when it's filtered down for you a little bit, because your emotions are, I don't mind around the topic, as I said, just because I'm the mother and it's my job. We're big. And we were constantly evaluating it.
I remember talking with you about that, and exactly your question. I have to be the one to decide when he starves to death, I think you said. And another thing I think that palliative care should be doing is to help reframe things like that. And reframing the goal of feeding at end of life is different. You're feeding for comfort. And if the feeding is not comfortable, you don't feed. And if there if there is either pleasure or comfort or visible relaxation with feeding, then you do it. But it's because the need for the G-tube changes from extending life to comfort, to keeping someone comfortable.